Hello and good morning, everyone. Thank you again for joining us. My name is Jessica Zavala, and I have the pleasure of welcoming you on behalf of the Ohio Program for Campus Safety and Mental Health to today's webinar, The Impact of COVID-19 Among the DD Population in Higher Education. And today I am really excited to welcome a panel of experts from Cuyahoga County Board of Developmental Disabilities. But before I introduce them, I do have a few quick announcements to share with you all. Our next webinar will be held on April 23rd at 1 p.m. Dr. John Torres from Psychiatric Services and BIMDC, which is an affiliate of Harvard University, will be on hand to discuss beyond telehealth informed decision-making around smartphone apps for college mental health. And so we were really excited to welcome Dr. John Torres to discuss college mental health apps. I would also like to extend the invite to you all for our upcoming biennial conference, which will be virtual this year, Creating Community Wellness, Equity, and Inclusion in Student Mental Health. And that will be held on May 18th this year, and we are excited to announce that Dr. David Rivera from the Steve Fund will be our keynote presenter. And so please be on the lookout for registration details via our listserv for both of these upcoming events. Finally, the webinar today will be recorded and a video will be made available on our YouTube channel for today's presentation. And now I'd like to briefly introduce our panel for today. We have with us Miss Ashley Burt. We have Valerie Miller. We have Amanda Papa. I'm gonna probably not say this right, but Kufchak. We also have with us a very special student, Grace Blatt. And so without further ado, I will go ahead and turn it over to our panel for today. We thank you all so much for your time and being here today.
Awesome. Thank you so much, Jessica, for that introduction. As Jessica said, today we are really thrilled to have you all here for our presentation, The Impact of COVID-19 Among the DD Population in Higher Education. So a little bit about who we are really quick. My name is Amanda Papa Kufchak. I am a forensic liaison with the Cuyahoga County Board of Developmental Disabilities.
I'm Ashley Burt. I'm a licensed professional clinical counselor at the Cuyahoga County Board of Developmental Disabilities.
Hi, I'm Grace Blatt, and I'm a Good Life Ambassador for the Cuyahoga County Board of Developmental Disabilities.
And I'm Valerie Miller. I am a speech-language pathologist working primarily with the adult population at the Cuyahoga County Board of Developmental Disabilities.
And as county board employees, I think it's important just to let everyone know our mission, which is to support and empower people with developmental disabilities to live, learn, work, and play in the community. We just want to take a moment to go over our session objectives for the day. At the end of this presentation, we hope that you are able to recognize the concerns and challenges faced by the DD community during the COVID-19 pandemic, including physical, psychological, and social impacts. We also hope that you can identify contributing factors to the unique challenges experienced among the DD population during the COVID-19 pandemic, recognize the benefits of the COVID-19 pandemic for some in the DD community, and identify practical strategies and resources that can be utilized to better support individuals with DD through the COVID-19 pandemic.
Before we get down to the bulk of today's objectives, I just want to give a very brief overview of the population that we're talking about, just to provide some context for those of you who may be unfamiliar with the DD population or disabilities. And disability is a pretty general umbrella term that covers a very wide range of people with varying presentations and needs. But basically, a disability is really any condition or impairment of the body or mind that leads to some sort of activity limitation, so making it more difficult for the person with the condition to do certain things, and leads to participation limitations, so how that person interacts with the world around them. Again, the scope is very wide, and there's many types and many things that affect a vast amount of people, including issues with vision, movement, thinking, remembering, learning, communicating, hearing, mental health, social relationships. About 61 million adults living in the US have a disability. That's about 26%, or 1 in 4 people, and that's quite a bit. So under that umbrella term, we're talking today about a subpopulation of individuals with developmental disabilities, or we're referring to them as people with DD. Grace, Val, Amanda, and myself, we specifically work with people with developmental disabilities. Research shows that about 1 in 6, or 17% of children ages 3 through 17 have 1 or more developmental disabilities. And a developmental disability is considered a chronic disability of a person that is attributable to a mental or physical impairment. It's manifested before the age of 22. It's likely to continue indefinitely, and they experience substantial functional limitations. And that person usually requires a combination of lifelong treatment and supports. There's a misconception that all people with developmental disabilities have intellectual disabilities, and reduced intellect is not uncommon, but it's not always present. And not everyone with a developmental disability diagnosis have the limitations that meet the level for eligibility for our services. So when we talk about the DD population in COVID-19, the DD population has been considered to be one of the most vulnerable groups throughout the pandemic. And when I say vulnerable, I'm referring to the vulnerabilities of contracting COVID and then also having serious implications, including death if COVID is contracted. So why is this the case? There's several reasons. One of the biggest is probably that adults with disabilities are 3 times more likely than adults without disabilities to have serious underlying medical conditions, many of which can lead to increased complications if COVID is contracted. Also, many individuals with developmental disabilities rely on some type of caregiving, whether that's from their natural or paid supports, to help them live their everyday lives. So their risk of being exposed to others is definitely increased compared to the general population. Those with limited mobilities or limitations in their activities of daily living that require physical support makes being in close contact with others unavoidable. Also, many individuals with DD are living in settings with housemates or with their family that where they're also getting support. Some have staff that are coming and going. There's low state reimbursement rates for care for this population, which generally means low pay rates for the direct care staff working with them. So caregivers are coming and going. There's a high turnover rate. There's also caregivers that are working multiple jobs that increases their potential of being exposed or contracting the virus and then carrying it on to a person that they're working with. Also, in the beginning of the pandemic, the PPE was pretty difficult to find. Priority, we know, was to get it to the hospitals and to those on the front lines. And so people in our community and their caregivers and family members who were providing physical care were often not able to find the equipment that they needed to be safe when providing these direct supports. Also, for some within the DD community, particularly those with cognitive limitations, there's a lack of understanding or appreciation regarding social distancing, the restrictions and closures and other safety measures. So the measures were not always followed as they should be. There's also other special limitations for some in practicing safety precautions, possibly due to inability to tolerate because of maybe sensory issues or remaining 6 feet apart due to impulse control. Communication differences is also a big factor here. These differences make it difficult for some to share their symptoms with caregivers and family medical professionals to be able to be treated appropriately and in a timely manner.
So we want to delve a little bit more into communication because it is one of the most significant challenges for people with developmental disabilities. And many people with DD have communication challenges that, of course, existed even before COVID. So people with developmental disabilities are likely to have some degree of receptive language disability, which is that they may have difficulty understanding language and speech. And some may also have an expressive language disorder, which means simply that they may have difficulty being understood. I put this up here because it's a really good visual representation of the whole communication model. I think we've all seen that if we've had our Communication 101 class, either in college or in high school, but it's kind of representative of the whole process, so I wanted to revisit it. First of all, on the left-hand side of this model, we have the expressive language side. You can see the person sending their message. So that's the sender part of the whole process. And when the sender is sending, they're communicating wants, needs, and desires. And they're communicating to the receiver, who's on the right-hand side of the model. The receiver is the receptive language part. And obviously, they are understanding and also processing the message that's being sent. At the bottom, you can see that the model points out that communication is always mutual. It's a mutual focus and a mutual activity. And at the top, there's always a message going. And after the message is sent, there is feedback. The little box in the middle says modes. And of course, the one mode of communication that is most common is verbal speech. And you can see here that that is what's represented. I know we can think of a lot of other modes of communication, but I did want to point out that many of the folks, the DD population, are either nonverbal or may have impaired speech or language. So they may use other modes, including American Sign Language. You may use gestures, facial expressions. Proximity is something people sometimes use to communicate if they are nonverbal. They might come up close to you to get your attention. Body language, vocalizations, not necessarily verbal speech, but making different sounds, and touch. I'm probably forgetting a few, but there are a lot of modes through which we communicate, and not just people with DD. I mean, we all use many modes to communicate. But I bring it up because when you can't leave your home and you don't have access to technology, like many people didn't, especially at the beginning of the COVID pandemic and the beginning of the isolation, people who already struggle to communicate because they have limited means were now even more vulnerable.
So in general, when we're looking at disabilities, developmental disabilities, and mental wellness, a recent CDC study looking at the occurrence of frequent mental distress among adults with disabilities under kind of that broad general umbrella term, it revealed that adults with disabilities report mental distress almost 5 times as often as adults without disabilities. And when they were looking at frequent mental distress, it was defined as feeling emotionally unhealthy, very sad, anxious, or troubled for at least 14 out of 30 days. Now, when we're looking specifically at the DD population, research suggests that about 40% of all persons with an intellectual or developmental disability also have a co-occurring mental health condition. And again, is more prevalent than among the general population. So given that we know that people with developmental disabilities are more susceptible to mental distress and mental illness than those without disabilities pre-COVID, I don't think it's very surprising to learn that we have seen an exacerbation in mental health issues in this population during COVID, such as those increases in depression, anxiety, and even fearfulness. There's a lot of fears of contracting COVID, fears of being forgotten, fears of losing even more independence due to some of the government issued restrictions early on, some that were particularly just related to this population. Fears of not receiving the same care or treatment of those without DD if COVID was contracted. And clinically, in my own practice, in my own work with my clients, I've seen a lot of changes in outward behavior, increases in agitation and aggression and self-injury, sleep disruptions, changes in eating patterns, even leaving and wandering their homes, usually because they're bored, they want something to do. Maybe there's not an adequate understanding of why we need to remain home, during the shutdown. So if it's not surprising to see an increase in these mental health issues, given what we already know, but why? What's contributing to this? And it's likely due to multiple stressors in their lives, and many, quite honestly, that were already issues prior to COVID, but have intensified by conditions created by the pandemic. So we're going to look at several of these factors. That's just a visual representation of what we're going to be going through now. So the first stressor is this limited community resources. This is particularly important when we're talking about mental health supports and services. That's been a longstanding issue in the DD community pre-COVID and intensified since. Even pre-COVID, there's been adequate mental health professional training of assessment and treatment for those with DD. There's a lot of complexity in presentations and diagnosing somebody with a mental condition and a developmental disability, especially those with more cognitive impairments, is very difficult. There's a lot of diagnostic overshadowing, attributing presenting concerns as really a manifestation of their developmental disability or condition, as opposed to what may really be going on in an underlying mental health issue. Again, we keep talking about communication, but it's important here because there's a lot of communication differences. And our DSM relies heavily on self-report. So it's hard for some in this community to communicate those internal feeling states that's needed to make diagnoses. And we really rely heavily on outward behavior. And behavior can be easily misinterpreted. Or we're relying on this collateral information from caregivers or family, staff, which can also be easily misinterpreted or represented to you as a clinician when it's shared. Traditional treatment modalities are not always effective either. Therapists are pretty quick, at least in my experience, to terminate services because the person isn't making a lot of progress or they can't benefit. But it really could be related to using models that are just not appropriate for that person. We also tend to jump to medications pretty quickly without exploring alternative non-medication based supports. And in general, there's a lack of resources between and communication between the DD community and the mental health systems. We're two separate systems. We can be a bit rigid and inflexible. Care can be delayed or rejected because of that. There's a lot of pushback on both systems. Well, this is a DD issue or this is a mental health issue. Individuals can be caught between two systems, and there's not a whole lot of support on how to navigate both systems, and it does increase burden to the family and providers. And these issues continue to be there during the pandemic, particularly as mental health services have moved to telehealth. There's a lot of difficulties accessing technology for telehealth. There's an additional need possibly for support from others, such as family or caregivers, to access therapy and then participate in sessions. It reduces that privacy for that person. It can be difficult for the clinicians to assess remotely. Clinicians, again, rely heavily on changes in observed behavior for some in our community, which is not always easily done over a screen in many cases. And then just ongoing difficulties with the person engaging in therapy due to environmental factors and increased distractions, possibly in the home, depending on where they live. Other general community supports, like the board of DD staff or teachers, professors, specialists working with that person, are again not available to provide immediate input or immediate support. There's not as many, at least for us, home visits going on right now. This does increase the vulnerabilities of abuse and mistreatment for some of our folks that really rely on our ongoing involvement and face-to-face to make sure that they're okay. There's also alternative non-medication based supports are not available that have contributed to mental health stability. So social groups in the community, their vocational or day program support, volunteer groups, leisure groups. And then when we looked at one study that was looking at the perspective of students with disabilities in higher education and accessing support, it found that it was unclear for some students of where they could find and obtain support. And ultimately, the disability and accessibility accommodations were hindered at the start of the pandemic.
So obviously, communication is a significant psychosocial stressor. And having difficulty understanding language or expressing language can really impact a lot of things, including your ability to follow rules. Obviously, if you have receptive language problems, you might not understand it, or you might, if you have working memory problems, not be able to hold on to those rules. The same with the ability to understand the consequences of negative behavior, the ability to give true answers to questions, and I will touch on that a little bit more later when we talk about yes-no questions and the reliability of a yes-no answer. The ability to problem solve, and also the ability to participate in conversations. So what factors do affect understanding the message being sent? Well, for one, the speed of the communication. If the words are coming rapid fire and somebody has slower processing time, they may hear the words, but they're not able to actually process them and hold on to them. Also, the length of whatever the message being sent that can impact. If it's too long of a message, people might not be able to hold on to the whole thing in order to process it. The complexity of the message, if it has a very complex structure, the sentence or the whole communication, or maybe if the words are hard words or bigger words, that can impact the ability of somebody to understand it. Word meaning and vocabulary, I think I just touched on. Word order, going back, is something that's kind of interesting, because some folks with developmental disabilities are very concrete thinkers. So for example, if I were to say, before you go sit down, I want you to brush your teeth, somebody who's a concrete thinker might process that or hear that as sit down, brush teeth, which is not the message you intended to send. Because you said it in a more complex way, it wasn't understood that the way you intended it. And finally, I wanted to mention vocalics, because many of us don't think about this, but a lot of folks with DD may have some auditory sensory issues, and vocalics are comprised, that whole umbrella term is comprised by your tone of voice and the loudness of your voice, rate, pitch, stress, all the things listed there. And if you're speaking too loudly and somebody has an auditory sensory issue, they're just trying to mitigate that and take care of it, and they're not really getting the message. I put this up because I think it's a really good representation of what COVID-19 has done to communication. On the left-hand side there, you see that face-to-face communication in that pie chart is comprised of body language, tone, and words in descending order, where body language is the biggest piece of the pie when we're communicating in the whole piece, right? And followed by tone. And the words are really the smallest part of our whole of our message, right? If you're communicating on the phone, you can see that we've taken body language out of the picture entirely. So tone comprises most of it, followed by a little chunk of that is words. So because we don't have this technology and we don't have this face-to-face ability, folks with developmental disability who already have trouble communicating are having such a difficult time communicating during this time period. And learning remotely has added a whole new layer of stress and complexity because of that.
The next area we're going to look at is isolation. And I think most of the world and everyone probably watching this can empathize a little bit with the feelings of isolation and loneliness due to the stay-at-home orders and other restrictions. And obviously the DD population is no different from that. But unlike the general population, those with DD and living away from family, and they're relying on these caregivers for support. They're often in group settings, and they have additional restrictions because of that, with staff coming and going, and aren't able to see friends and family as freely as you or I can. Like others, there's obviously restricted access to their school and work and vocational programs and day supports. And these things really were anchors for a lot of these folks, and offered daily opportunities for socialization and comfort that they're not receiving anywhere else. The typical leisure groups are canceled, again, which people in this community really rely on for their social involvement and community inclusion. And then there's also this history of being singled out for this population. And for some, there's a lack of understanding that the lockdown and restrictions are for everybody. And it's not just for them, not just for people with DD. And so there are some that have viewed as a punishment or feel as though they're being left out and that things are still going on around them when in fact it has kind of stopped for everybody.
In my role with the county board, I work with our individuals who are either being charged with a crime or victims of crime. So of particular interest to me during the lockdowns and during the pandemic has been relationship strain, and specifically what's been going on with our individuals as they're staying at home longer. No surprise, lockdowns have forced people who cohabitate to remain in close proximity. That could be family, intimate partners. We're all spending a lot more time together, and we're all spending a lot more time at home. So I think it's important to note that it's common knowledge, it's said a lot on the news lately, that crime is down during the COVID-19 pandemic. We've seen a decrease, which on the surface sounds fantastic. But as we start to break that down, some early studies and early research are starting to show that crime as a whole is down, but where crime is focused seems to be changing. So, for example, domestic arguments calls have more than doubled during the COVID-19 lockdowns. So, as a whole, the crimes that are committed in groups, the crimes that we're seeing committed in the community are down. But the relationships at home, intimate partner violence, domestic violence, calls for that have increased. And I think that especially for the DD community, who through research we know is at a greater risk of being victimized, this has been something that's increasingly concerning for me and a lot of the work I do, because I'm starting to receive more referrals for individuals because of domestic arguments, threats at home, protection orders, things like that. And considering that when dealing with students or anybody within the community who has a developmental disability, it's also important to consider the relationship factors at play.
Additionally, currently there's a staffing crisis within the agencies that serve people with developmental disabilities. So those that do need additional support day to day. The shortage of staff means that people receiving services are often getting a rotation of new people coming in who don't have an established relationship with them. They don't have rapport. They might be not as familiar with their needs, wants, preferences, communication styles. And not having that stable support has left some feeling more anxious, nervous, and unsettled, and even in some cases more isolated and lonely. We've seen an increase in conflicts among individuals with not only their staff, but also housemates as well. A big one, too, to take into consideration are these major disruptions in routines. And again, much like the rest of the world, the DD population has also experienced this major disruption in their lives. However, changes are even more impactful for some within the DD population. For example, those on the autism spectrum, they rely heavily on rigid adherence to routines to reduce anxiety and emotional distress. They count on consistency to maintain stability. That ongoing ambiguity of the future just perpetuates feelings of anxiety and distress. There's also been continued changes in practices and policies and procedures, as we all know, and have all been impacted by, but some in the DD community, especially those with cognitive limitations and those with differences in executive functioning, require extended time to process, accept, and acclimate to changes. Once somebody gets used to one change, another one's being made, kind of starting that process all over again of getting used to this new change. It's resulted in a lot of confusion, anger, frustration. There's also been complete changes in people's environments that requires a lot of adjusting as well. Being at home brings additional distractions for some, especially those with ADHD that struggle with concentration and focus. There's limitations in personal privacy, and again, a lack of structure without having regular routines in place. Additionally, college and university students with cognitive and learning disabilities reported struggling to adapt to new formats for course deliveries and the new expectations more than the students without disabilities.
I think a shift in use of technology is something we've all encountered during the pandemic. But one of the things that our community has struggled with especially has been technology. Many individuals that we work with don't have the ability to afford technology, such as computers, tablets, things like that. And they relied a lot on community resources like the library or going over to friends or family's house to utilize their technology. And this has contributed not only to their inability to engage in whether it be school, job, or other social interactions, it also helps them feel more isolated and disconnected from the community because of that. Valerie's going to talk about this in the future, but we have some stories about how we've been able to mend this issue. But a lot of our individuals struggle with technology in general and not understanding how to use the technology. So this is definitely worth considering as a definite stressor for our community during this time.
The final stressor we're going to discuss are these financial changes. Many individuals with developmental disabilities receive SSI or some kind of supplemental income, and they have very tight budgets, and they rely on a lot of their part-time jobs or even vocational work programs for additional income. For some, families have had to leave their jobs to care for their loved ones and assist with education. There's also this increase in unexpected expenses in technology, in the internet, in PPE, for caregiving, for even tutoring or additional support with education. Then I wanted to share the Census Survey where researchers surveyed about 30,000 students at 9 large public universities between May and July of 2020. The survey was looking at the impact of COVID-19 on 5 areas of student well-being across the board, including the ease of transition to remote learning, the financial impact of COVID-19, students' health during the pandemic, students' feeling of belonging and engagement, and future plans post-COVID-19. And the survey found that students with physical, learning, neurodevelopmental, cognitive disabilities were less likely to believe that they, 1, feel like they belong on campus, and 2, less likely to agree that the campus supported them during the pandemic. They also found that these students were more likely than their peers to experience financial hardships, which we already touched on, and food and housing insecurity during the pandemic. In fact, it found that students with disabilities were 3 times more likely than their peers to experience food insecurity during the pandemic than others. A greater percentage of students also with disabilities experience major depressive disorder that is thought to be linked to the pandemic, compared to 34% of students without disabilities. The surveys also found that the challenges students with disabilities already face in higher education are exacerbated by the conditions created by the pandemic. So students with ADHD often express that their home environments are too distracting for them to effectively complete their homework. Students with major depressive disorder are experiencing high levels of isolation and loneliness, and students with generalized anxiety disorders are encountering significantly higher levels of anxiety due to the unknown surrounding the pandemic and uncertainty about the future of their education. So kind of all of those things we've talked about in that higher education setting.
So one of the major exacerbating factors is challenges with executive function. And executive function, as the definition states, it refers to a family of top-down mental processes needed when you need to concentrate and pay attention, when going on automatic, or when relying on instinct or intuition would be ill-advised, insufficient, or impossible. So the core executive functions we're talking about are inhibition, which is restraint on direct action or kind of a slowing down of a process. Working memory, which is a part of your short-term memory. It's the one where it's sort of your high-speed memory where you're holding the stuff in it short-term while you're working. And finally, cognitive flexibility, which is basically your ability to either switch from one thing to another in your thinking, or to be able to think about and work on 2 things simultaneously. Learning remotely has added a new layer of stress and complexity. when we're thinking about things like executive function. So in terms of executive function, a lack of structure and routine, which I think Ashley just touched on, has made distance learning really challenging for folks with developmental disabilities in some cases. Routines are so important to all of us, but even more so for this population. Routines can decrease our anxiety. They help us increase control of our day. They help maintain our emotional well-being because we know what's coming. And they reduce challenging behaviors, which I forgot to mention earlier. Behaviors are also a form of communication, a mode of communication. But without the impetus of leaving home every day, and I'm sure you can all appreciate that. I think we've all worn our pajamas or yoga pants for a Zoom here and there. Without that, some students have experienced decreased motivation to complete their ADLs or activities of daily living. So their hygiene routines like brushing teeth or getting dressed or preparing their food. And this has created some real serious health and safety issues. Some other executive function challenges, not having immediate feedback from or access to your professor. If you have an executive function disorder, that can be really challenging to you. Doing so asynchronously is really challenging for students who have these differences because sometimes you can't hold your questions in your working memory. Sometimes it's just the process of figuring out, I can't talk to this person now, so how do I figure out where to get this phone number or what, when are office hours? There are a lot of things that we take for granted that are more challenging for some people. And finally, something to think about with online learning now, it sometimes affords people decreased opportunity for sensory breaks. And that can make focusing and attending to tasks challenging and fatiguing. So sometimes, for example, like when we're going to school and we have a set schedule, we know we're going to go to the bathroom in between. We know we might get fresh air or sunshine or just a change of venue. And when you don't have that and you're sitting in front of a screen, it's very challenging and fatiguing. I don't want to be all doom and gloom though, because there have actually been many successes. And so it's nice to know that there's a silver lining to this and we can look at some positive outcomes. Deb Riker in 2020 in the Journal of Child and Adolescent Mental Health wrote an article delineating some of these successes. For one thing, remote supports and learning are actually the preferred method for some of the folks in our population. It can reduce stress in the stress of social situations or expectations. There are fewer distractions in some cases, and some people say that the limited transitions throughout the week causes decreased anxiety. So I'm not going to go into that. That's all in our resources today because it is my honor and pleasure to introduce my colleague, Grace Blatt, who can give you a first-person account of so much of this.
Thank you so much, Valerie. Hello, everyone. My name is Grace Blatt, and I will be presenting you about my firsthand perspective of the COVID. Thank you so much. I am 24 years old. I have three sisters, two of whom who have Down syndrome. So I enjoy spending time with them and getting to learn from them. And I have autism spectrum disorder. I also live with my mom and Auntie M. I graduated from Lakeland Community College with an Associate of Arts degree, and I'm currently at Cleveland State University in my junior year, and I will be majoring in psychology and minoring in neuroscience. My goal is to someday become a neuropsychologist and get my PhD and go into the research field and study biomarkers for neurodevelopmental disorders such as ADHD and autism spectrum disorder. As a Good Life Ambassador at the Cuyahoga Board of DD, I am able to advocate, promote, and train people about disability etiquette, awareness, acceptance, and to help people with who are neurotypical to learn about not just about autism, but all kinds of different developmental disabilities. So today I just wanted to talk about how I came to the conclusion of that I needed, at the beginning of the pandemic, I was a real mess. And so meaning that I was anxious and I needed to find some way to get my life back together psychologically. And so I had to realize that I needed psychological help. I needed to realize that I'm stressed because things have changed. Things are not normal. And so first admitting that is a big step, because you're admitting that you are unable to get to be comfortable in your own skin without the help of someone else. So I needed help to cope with these emotions of stress and anxiety. So positive aspects of the pandemic, I will tell you that I've had more positive aspects of the pandemic than negative aspects, and it truly has enhanced my life. One thing to start us off with is that I don't feel as often to be left out of a group. So when I see people on social media getting, a drink or getting with friends, I feel a little left out. But now that no one's doing anything during the pandemic, I feel we're all in the same boat. I have more time to decompress between events. I don't have to worry about getting lost in new locations. I can be punctual I can be on time for things, and I like to be on time, if not early, to locations. And so when I don't drive, and so sometimes when my transportation doesn't know exactly where it is, I sometimes get anxious about being on time. I also like the pandemic because it allows more family time, and I'll talk about how that is helps me with my family. I have more control over my time management for school. I can wake up later. I can do my schoolwork at a good time for me. I usually get tired in the morning, so during the afternoon is when I do a lot of my schoolwork, and so I can learn at my own pace. The pandemic has improved my test taking skills, especially test taking skills that are not that inquire critical thinking, or like questions that test your ability to understand the question, not necessarily understand the content that you learned. And so I've been through many professors that have taught online, and so I've learned to get used to different test taking strategies and test taking different methods that teachers have been using. I have less opportunity, which is a good thing, to engage in unstructured small talk. So when students or between classes, I don't feel that I have to make friends, or I don't have to fill the empty void of space of between classes by saying something or trying to make friends or make myself prove myself to people. And so I feel that with COVID, everyone's at home, and so you just go to the class and then you leave. You don't have to loiter around, or you don't have to wait around for class to begin. Now there's a few negative aspects. Cabin fever, to me that means I get a little bit bored of the same thing every day. And one of my aunts told me that she said it's the COVID is like 6 Saturdays and a Sunday, so I can't keep track of the dates. I had to always check my calendar on my phone. Oh yeah, it's almost, it was like on St. Patrick's Day. It's St. Patrick's Day, I forgot about that. And so I also lack the need for the stimulus of the positive stimuli of face-to-face interaction. I enjoy hugging people. I enjoy personal touch, and for an autistic person, that might be, some people consider it a hyposensitivity where they lack that, or they consider it a hypersensitivity where they can't stand to be touched. So loneliness, I think we can all relate to that. a more sedentary lifestyle. I've noticed at the beginning of the pandemic, I have a hard time getting motivated to get out of bed or motivated to get up and go for a walk, even though I have a dog. It's a little bit more challenging. This is interesting because even though I thrive on routines and things like that, and predictable schedules, I like to have surprises. I'm like anyone else. Everyone likes to have, oh, I got you something, or I got something in the mail, or we're going to celebrate your birthday, or we're going to celebrate that you finished, your semester with a 4.0. We can't do as many of those pleasant surprises because we have to do a lot of planning and things like that. So eating more, I definitely am at chief of that, and so I really have gained a little bit more than I wanted to. But in the following slides, I'll talk about how I'm trying to mitigate that. I have more depressive thoughts and feelings sometimes when I tend to just sleep all day or things like that. I tend to get more depressive, but I try to through different therapies and different activities, and through the help of my family, I've been able to get through that and make myself productive instead of just lying around. Now, the enhancement of life is very good because this relates to more about my life as a person with autism. I'm able to be on more committees and help out to be part of more organizations due to no need of transportation. So I can be part of honor societies. I can be part of different volunteer groups or bingo night or things like that, because you don't have to travel all the way from northeastern Ohio to Cleveland State. So that's nice. I don't have to engage in small talk with other students before or after class. So sometimes that can be very nerve-wracking because I feel like I have to fill the time, because then if I don't, I might feel awkward, or I might feel like I'm a shy one, or that I'm a misfit. And so I try to engage with other students. I also have time to relax by crocheting and making jewelry, which helps me with my sensory needs by calming me down and relaxing me. I don't have to worry about stimming or keeping my hands busy in public places. Sometimes stimming or self-stimulatory regulation is done with autistic people, like rocking in your chair or flapping your hands when you're excited. Or I do this when I get very excited. And so when I do that, sometimes I don't always realize that I'm in a public place, and so sometimes I get embarrassed, or people might give me weird looks, and so I don't have to worry about masking as much or hiding those self-stimulatory needs that I have, so I can be more relaxed. I can learn at a faster pace, which is comfortable to me. Because I'm at home, I process things very fast, and because I have a 4.0, I enjoy working ahead in my classes that professors that you're allowed to in certain classes. So I enjoy doing things at a good pace for me. Another thing that I've been able to express my feelings or try new jokes on my family without being ridiculed for being weird and inappropriate. So a lot of the times I say things or ask questions that I wouldn't ask in a normal setting, because I'm afraid people would say that's a silly question. And so I really feel comfortable in getting more opportunities to share what I think and process the things and ask questions. I have more time to make decisions. I can think about something and then reply maybe in an email or a little bit later. Slower pace, deadlines, and expectations. I think people are all more considerate of each other and more understanding if maybe we didn't get the email, or we didn't go to the office that day and didn't mail something or send something out. I think people are more understanding. So there's a slower paced expectations for people to get things done. I feel like we need that because of COVID, there's so much more planning involved, like where to meet up if we are meeting up with our masks, or where, what time are we meeting, when to get on Zoom, things like that. And there's less spontaneous events like, oh, are you available? Let's go to the mall. Or yeah, let's go see a movie. There's less of spontaneous events, which works for me because I like things to plan and I like to look forward to them. I also work on my coping skills at home because when I am in public places, I never know whether this new behavior or this idea that I have might be considered on borderline inappropriate or just awkward. And so I can ask my mom or my NTM for advice and say, when I do this, is this appropriate? Or should I think of another way of handling the situation? So this is my last slide, but one of the things that helps me that have helped me get exercise and helped me become healthier is I've had a small landscaping job this past summer that helped me get exercise, and I was able to make friends with neighbors around my neighborhood. I made friends with other neighbors right across the street by getting the mail for them on a daily basis and taking the trash cans up and down the driveways weekly. And so one of the things that I learned is that I'm not the only one who uses. I thought I was the only one who used Garbage Eve, and so I always go up to my neighbors when I get their mail, and I said, tonight's Garbage Eve. In fact, today, Tuesday, is Garbage Eve for us. So today at 6:30, I'll be taking out garbage for my neighbors and remind them it's Garbage Eve to put your trash cans out today. So I decided to take as many online courses as possible rather than in person. I think I can avoid a lot of these, as I mentioned before, a lot of the different awkward positions and awkward circumstances if I take classes in online. Another thing that helps me, and maybe a suggestion if you're educators or in some kind of administrative position at a college or a school, even high school, would be sometimes I ask my professors if I'm very anxious or I seem like I'm stimming a lot, the whole class can see that, and so that's pretty embarrassing. I also have horrible eye contact, so sometimes it looks like I'm not paying attention or I'm daydreaming or something. So this could be a really neat accommodation for schools and universities to have for students to if they need a day to turn off the webcam video and just be there, but not be subject to ridicule and things like that. And so that is my part of the presentation, and I would like to turn it back to Ashley.
Thank you, Grace. That was wonderful. You're so inspirational, and we're lucky that you were able to come and help us with that today to provide such a great firsthand perspective of somebody that we're talking about here and your own unique positive perspective and spin on everything. I love it. So I'm kind of piggybacking off of Grace here and some other practical strategies to support this community. If you are a person with a disability, number one, become familiar with your rights, especially at school. Request support for from your school's Disability Resource Center and advocate for yourself. Nobody's really going to do it for you. Connect with your local Board of DD for support. If you're unsure if you receive supports from the Board of DD and you think that you may be eligible, you can contact any one of us. Our information's at the end, and we can try and help guide you in the right direction. Also, of course, seek help for mental health. Join any local support groups. There are a lot of things that are online right now that you can get involved in, and we'll have resources at the end for you. If you're a professional tuning in today, first and foremost, make sure that there's local resources readily available and easily accessible for food, housing, financial assistance, mental health options, medical care, and make sure you're providing that information in multiple modalities to meet all the needs. You can check with your local organizations like your Board of DD, even check with us that support people with DD for communication tools, assistive tech, and other resources related to COVID. Encourage your students to discuss any necessary accommodations they need for online learning with their school Disability Resource Center when appropriate. Check in regularly, remain approachable, and be flexible and person-centered in your approach and teaching style. There are a lot of differences, so make sure you're offering options. Honor and respect communication differences.
We touched on a lot of these, so I won't spend a lot of time on this, but in order to facilitate communication with people with developmental disabilities, and I would say this is probably good for just about anybody, use simple language and vocabulary whenever possible, be concise, so speak very concretely, as I mentioned before, and avoid lengthy sentences. You can break information down into chunks, especially if you're giving maybe 1 or 2 directions or more, do it one at a time. When trying to establish timelines, it may be useful to use examples from daily routines, such as breakfast or lunchtime, instead of saying, call me at 8:30. Some people don't have the concept of time down. You might say, call me after breakfast. Concrete language, I talked about that again. Make sure we avoid idioms and jargon and all of that big language that sometimes in our own fields we use. Give choices. Sometimes open-ended questions can be overwhelming, and avoid yes/no questions whenever possible. Make sure you're progressing slowly and leaving pauses for the person to process your words. Processing takes time for all of us, but even more so with some folks with DD. And sometimes a pause is very uncomfortable and it seems a lot longer than it is, but if you start talking, you've interrupted somebody's entire process of trying to think about and respond to your message. You can repeat messages if it's been a really long time and there's no response. Comprehension should be checked periodically, preferably before going from one topic to the next. And just remember, everybody's different. There's a wide spectrum, obviously, of communication abilities and modalities and styles. So here I've presented you with a list of do's and don'ts, and to save time, you can see on the left side, the do's are all open-ended questions. If you're checking for comprehension, tell me what I said. Why is it important? As opposed to any yes/no question. Yes/no is not reliable. Even neurotypical people sometimes, like if you're in a foreign country and somebody's coming a mile a minute at you very kindly telling you something and you don't understand it, but you're really embarrassed and you just want that interaction to stop, you're going to nod your head and smile. It's not a reliable way to assess somebody's comprehension. So try to ask an open-ended question. Provide lots of breaks. Change settings if you find that somebody doesn't seem to be understanding very well somewhere. There could be sensory issues in that room. There could be a buzzing light or a bright light. Sometimes changing the room's a good thing. Processing time, we talked about jargon. And please never make assumptions about what anybody is saying or meaning. Their message is sacred, just like yours is. We want to honor everybody's communication. So don't just assume what somebody is saying. Really make your best effort to figure out what they're really trying to tell you. One of the supports we have for folks with DD is Assistive Technology, which is any system or piece of equipment or product system, whether it's acquired commercially or it's modified or customized, and it's used to maintain or improve the functional capabilities of individuals with DD. Some examples of things that fit this bill are Ring doorbells, Alexa and Google Home and things like that. Maybe flashing or vibrating alarm clocks come to mind, to help people who are blind or deaf. And also alternative and augmentative communication devices like Stephen Hawking is probably the one example everybody knows, but they can range from low tech like picture systems all the way up to the most high tech. Cuyahoga DD has an assistive technology department. There are many SLPs who specialize in AAC and assistive technology specialists. And what we do there is we do assessments for those very pieces of equipment. We lend those pieces of equipment and software for trials. We have a fantastic lending library where people can try before they buy, or sometimes we've lent things out just to help people through the pandemic. We assist with acquiring and funding of those pieces of equipment. And finally, we provide training and in-services on those pieces of equipment. So during the pandemic, some of the stopgap measures that my department has implemented just to help people through this crisis during isolation are that we've loaned iPads out to people for the purpose of maintaining that connection we all talked about, as well as to provide applications for games so people stay engaged and happy and have things to do. For scheduling supports, as Grace mentioned, it's really important to have structure, and obviously for learning. So we've use things like Microsoft 360 and other things, and we've done training on that. So we do have this. My contact information is in there. Feel free to reach out if you have questions about that, or to your local Board of Developmental Disabilities, because the Lending Library is a tremendous resource.
And lastly, I want to go over some of the resources that are on here. There's a lot of great websites. If you're looking for more information on developmental disabilities, there's resources specifically on DD and mental health. There's a few really great associations that I listed there. And if you are a clinician that's tuning in here, they do offer a lot of great conferences there to learn more about DD and mental health. There's information on disabilities and higher education, on disability rights, and also for autism spectrum disorder if you are interested in that, or if you're a person tuning in on the spectrum. And then just continuing with some additional resources there. And those are just our sources if you're interested as to where we got our information from. And I know that we're a bit over here, but our contact information is on the last slide here as well, if there are questions.
Certainly. So yes, we are a bit over. And first and foremost, I just want to thank you, Ashley, Valerie, Amanda, and Grace for that amazing and very informative presentation. And so I guess at this time, we will go ahead and stop the presentation. Again, thank you all. Very informative, very well presented presentation. Grace, you definitely inspired me to look at the positive aspects of the pandemic that I had not considered. And so thank you so much for your presentation today. And you can take a look at the chat. Folks are still commenting on the overall very good job on the presentation. So thank you all again, and enjoy the sunshine. And we will follow up if there are any additional questions. Thank you again.